right. Good evening, everybody. I'm glad that you could join. My name is Lanning. I'm a nurse practitioner with the Ear, Nose, and Throat Clinic. And tonight's discussion is about tinnitus and how to beat the buzz in your ears. And mainly, we're just reviewing the treatment options that exist for tinnitus and to hopefully give you a little bit more understanding of the pathophysiological process. So a little bit about my background. As I mentioned, nurse practitioner by trade. I've worked in ear, nose, and throat for about 6 years total. Close to 3 years here with Spectrum Health Lakeland. And prior to this, I worked in an ear, nose, and throat clinic in Iron Mountain, Michigan, in the Upper Peninsula for about 3 years. So our agenda for tonight will cover what we know about tinnitus, how we diagnose it, the different relief strategies, a little bit about support groups. Those are important. A patient testimonial that I think you'll find helpful. And we'll talk a little bit about COVID-19 and tinnitus. I think that is actually quite pertinent, especially in the current times that we're in. And then we'll move on to the next slide. And my goal tonight, or our goal, I should say, is that you leave this presentation feeling more educated about tinnitus and have some options for relief management. If you have any questions during the presentation, you can submit them by using the Zoom chat feature. I will try to answer most of these to the best of my ability at the end of the presentation. Also, the presentation will be recorded and available online and through email. And for any individuals who may have trouble hearing, we can also share a document, a PDF file of this presentation. And as well, to definitely let us know if I happen to be speaking too fast or hard to understand for any reason. We do want to make sure to get the message across. And we can go to the next slide. So tinnitus, what is that sound? Tinnitus or tinnitus, but commonly called tinnitus, is a sound that is heard in and around the head or the ears. I will often refer to it as ringing, but it can come in a wide variety of sounds. Ocean waves, squealing, hissing, whooshing, static, buzzing or clicking, phone dial tones, and I've had some people tell me they can hear multiple different tones at once. So there's no specific sound that you should hear. It can be a wide variety of things. And then the next slide. So what else do we know, statistically speaking? According to the American Tinnitus Association, an estimated 50 million people in the United States have chronic tinnitus, meaning that in one or both ears they are experiencing a sound that's lasting longer than 6 months. So 50 million people, if you think about the United States, we have 360 million people roughly. So to put 50 million into perspective, that would be the population of California plus the population of Michigan. All those people there have tinnitus. To put that into perspective. And for 12 million of those individuals, it is severe enough to affect their activity of daily living and can be quite disabling. So 12 million people, that's a little bit more than the population of Michigan. We have about 10 million people here. So the next slide. So who is affected by tinnitus? Can happen to anybody. Mostly with increasing age, we'll see it, but it can occur in children and teenagers. We also find it's more common in men than in women. And also of interest, it's more likely to occur in individuals who smoke. And next slide. Don't get too bogged down with this illustration here, but the take-home message here is that it's theoretical models are our best understanding of why tinnitus happens. This particular model here shows both what we call the peripheral nervous system, and that's things that happen outside of the brain, and then the central nervous system itself, which is the brain. And wherever you see these arrows, you can imagine if any problem goes wrong anywhere in those pathways, that can result in tinnitus occurring. And we can go to the next slide. Presently, there's no magic pill or surgery that can correct tinnitus. There's a lot of research being done, which we'll discuss, but as it stands, it's a chronic condition. But with evidence-based treatments, we can make tinnitus more livable and manageable. And what our overall goal should be, our mentality should be to reduce the burden of tinnitus the best that we can through the best available evidence we have, which entails multiple different strategies. So the analogy I'll make is, chronic disease states, which we think about hypertension, diabetes, high cholesterol. So we don't only just take medications, but we also implement dietary and lifestyle changes too. And tinnitus, we have to treat in a very similar fashion to that. Next slide. This is the hearing pathway. It's probably an illustration that I'll go to every now and again to explain what exactly, where the problem occurs. You can see there's a big arrow, sound wave traveling to the eardrum. Goes through the eardrum, it's amplified by some degree, and then travels to that snail-looking structure, which is the inner ear, cochlea, and the semicircular canals and various structures, which are also responsible for balance. And you can see in the arrow pointing down, there's these small hair cells, and we think that damage occurs to those cells and or they cease to function. And then that relay of sound is not as efficiently sent to the brain or at all to the auditory part. And we think it's a compensation mechanism within the brain itself that ends up resulting in the different sounds that people hear. And if we can go to the next slide. So as I may have alluded to, what is the most common cause of tinnitus? It is hearing loss. So hearing loss is the most common cause and can be due to a combination of things, whether that's genetics, it's a big driver, family history, which includes genetics, noise exposure, very, very much a risk. So high decibel sounds from occupation or otherwise, and the aging process. And in the illustration that we looked at, did cover anywhere where a problem can go wrong. And little statistic there from the British Tinnitus Association, about 90% of tinnitus is related to hearing loss. And we can go to the next slide. So additional causes of tinnitus, other common causes, it can include tinnitus with pain in the ear or drainage from the ear. One ear that hears better than the other without really good explanation for it. Any sudden hearing loss in the ear, pulsing sounds in the ear, Meniere's disease, which I won't go into in depth, but that can also entail hearing loss among other symptoms, or tinnitus in just one ear. Take-home message here is if you have any of these symptoms, these do warrant medical evaluation, and we do recommend that you see a provider for this. And we'll go to the next slide. Common question, I'll get asked in clinic, or my colleagues will get asked in clinic, is what things can make tinnitus worse or make the ringing in the ears worse. These are some of the most common things. First one we'll look at, clinical depression. Now, does everyone who that has depression, do they have tinnitus? No. What we're looking at here is if somebody has either undiagnosed depression or maybe even suboptimally treated depression, which also entails a whole host of other arrays of treatment. But if that can be optimized, usually people's experience of tinnitus is far less. Insomnia, in other words, trouble falling asleep, staying asleep, that can also make tinnitus worse. Another common thing that we'll also see is temporomandibular joint disorder or jaw joint arthritis. So anything that can include this area here or the muscles around it. It can cause what we call like a somatic or referred tinnitus, which can also amplify and make worse tinnitus for people that already have it. Certain medications, there are some classic medications that we know that can cause this. I won't go too much in depth to that. That might be a topic we could address in chat to some degree. But it's something that we also look at too as a cause. Stress. Needless to say that that's something that exists for everybody. If somebody finds a cure for that, more power to them. But it's something to keep in mind. Social isolation, especially with early in the pandemic, that was probably much more the case for most people than it was previously. But in people who are isolated with their thoughts to themselves, sometimes tinnitus is the one thing that you end up focusing on, which can make the experience far worse. Poor dietary habits. So we'll pick on, excessive alcohol consumption that can make tinnitus worse, or high doses of caffeine intake that can do it too. Sedentary lifestyle. So in other words, lack of or no regular physical activity. And as I mentioned earlier, smoking. The thought processes that can cause damage to the blood vessels that supply the ear, or even toxic to the ear itself. So that's just always something to keep in mind. We all know that smoking is not good for our health, but as the reasons pile up to quit, hopefully this also can add more weight to that decision. And then we'll go to the next slide. How do we diagnose tinnitus? Well, first we recommend that you see an audiologist. These are well-trained, well-qualified individuals that we work with. And they're the ones that carry out a test called an audiogram. We also check the eardrum and the eustachian tube for problems that may also be contributing for tinnitus as well, and that's called tympanometry. And it's common that we do find, to some degree, hearing loss affecting both ears. One or both. Sometimes it's in a high enough frequency that it might not even be noticeable to the person. So key point being that it may be the first sign that there is some hearing loss present. Next slide. All right, so this is an example of an audiogram. I'll explain it the best that I can without being able to point at things. So if you're looking at the screen, to your right-hand side, those are the highest frequencies, and then to your left are the lowest frequencies. Basically, if you see the 500 at the top, that's hertz. So between 500 and 4,000, those are our speech frequencies. And then down the side column there, where it says hearing level and decibels, that's the amount of volume that needs to be delivered for you to perceive the sound. And this is an example. This is from Audiology Online. This is a 50-year-old woman, less than 24 hours, following a rock concert, and she was complaining of tinnitus. And if you look, you'll notice that there's a big dip or a drop in the hearing in the high frequencies. It almost looks like the constellation, the Big Dipper. The right ear is the circle, and then the X is the left. And this would classify as a moderate nerve hearing loss, where that dip is. Normally what we like to see is a line straight across, but sometimes you will see these areas scooped out, but that would help support the diagnosis in this individual of why they may have tinnitus, because there is hearing loss present. And we can go to the next slide. So after the diagnosis, what's next? So we'll cover a few strategies that can help offer some relief. Some people find that using a combination of multiple strategies work best for them. So take-home message here is that it's not a one-size-fits-all approach. Everybody that's diagnosed needs something different to help them. So that's what we strive to do. We strive to see, what is the best options, or what are the next best steps. And then we'll go to the next slide. The first strategy is sound therapy, and I'll go into more specifics about what this means. And some people who have tinnitus that may be listening in may have found out about this inadvertently, or maybe read about it. Take home is, this does not cure tinnitus, but it can reduce the intensity, or at least temporarily distract you from what you're experiencing. And then we can go to the next slide. So underneath the umbrella of sound therapy, there's masking, distraction. You can think of these things synonymously. Um, so any sound generating device, like a radio, a fan, TV, or a computer or iPod, it can serve as a tinnitus masker. Um, so typically what you want to think about, the most effective masking sounds are ones that create a positive emotional response, meaning that, say, if I run like the sink in the background, now it's probably not a sustainable option to do because that'll run up the water bill. But if somebody's running water in the background and you go, I don't hear that sound, hey, it feels kind of nice. That's what you're looking for. That would be an example of like a positive emotional response. You're not noticing it as much and you're getting relief. The downside is sound masking devices, if we use it from that perspective, are usually only effective during or immediately after active use, meaning that some people they'll discontinue the sound and maybe have relief for minutes, maybe hours. Sometimes the sound comes back instantaneously, but knowing that provides a form of distraction for somebody that is, you can't hurt anything by doing it, and it actually can be helpful. And then we'll go to the next slide. Taking it one step further, sound and sleep applications. So sound and sleep applications can provide great relief for tinnitus control. So commonly, if I see people in clinic and we're discussing ways to manage, I usually will direct them to, most of us have like iPhones or smartphones, and if not, that won't stop any of us, me from making recommendations anyways, but we like to take advantage of the technology that we have. Like the Google Play Store, if you have a smartphone, or the Apple Store via the iPhone. If you go to the American Tinnitus Association website, which will provide also information on, they do have recommendations on what they find from user input and their own audiologists, what recommendations for apps may work the best. Most of these applications, the nice part is they are free to use, and they do provide relief for people, and it's the amount of time that you put into it. But I always caution people, just watch for any kind of hidden costs, or if it's asking for like a PayPal number or credit card thing, just make sure that you're not, you're being charged, not being charged for anything there. And as well, you don't have to limit yourself to one. Find what works. Find what gives you that positive emotional response. And we can go to the next slide. So the second strategy is behavioral therapies. And this includes, you can think of taking sound therapy, then adding this next step on top of it, like a pyramid or building blocks. Behavioral therapies, primarily we're using our mind and how we think about and conceptualize the problem and our emotional response to things. We use this to help reduce the perception of tinnitus. And there's a key word in here that we call habituation. That is the ultimate goal that we have for people for tinnitus. It does not cure it per se, but habituation is the process by which you perceive the tinnitus no longer affects your well-being, meaning that it may be something initially when it starts that somebody might feel like this is obnoxious, this is annoying, I can't get my mind off of it. And through the process of habituation, and I'll talk about more strategies here, but in a nutshell, whether it's sound therapies, lifestyle things that are implemented, optimizing certain medical conditions, there's a process by which somebody will start to go, oh, it's there, but it's not bothering me anymore. Or I notice it's there, but it doesn't, I don't worry about it. That's what our end goal is. And behavioral therapies are a big part of that. And then the next slide. So specifically for anybody who's done independent research, they may have encountered cognitive behavioral therapy. It's a very valuable tool. There are counselors and professionals that are trained in this that can administer it. But CBT for short, too, I'll use that acronym, in combination with sound therapies, work well for most individuals to reduce the burden of tinnitus. And you can see this list of things here. It's commonly education. You look at emotional triggers, how you respond emotionally to tinnitus, your thoughts and belief patterns regarding it, avoidance patterns, behaviors, and different relaxation techniques. So you're really trying to critically think about and analyze, why you may feel the way that you feel, and kind of giving yourself kind of control over the problem, essentially, is how you look at that. It's a very powerful tool. And it's actually, even beyond tinnitus, it's used in a lot of different areas as well. Next slide. Tinnitus retraining therapy is like a specific application of cognitive behavioral therapy. There's mindfulness-based stress reduction. In mindfulness, again, it's looking at your emotional response to things, how you perceive tinnitus, and kind of analyzing those thought patterns. Any CBT, including tinnitus retraining therapy, it's resource intensive, and there usually needs to be multiple specialists involved. So not only just ear, nose, and throat. You may have a neurologist. There may be a dentist. Audiology would certainly be in the mix. Counseling as well. So it's a multimodal approach. It's also time intensive for a person too, but it's never to dissuade anybody from that approach. It is very, very beneficial from that regard. And then we'll go to the next slide. Third strategy, hearing aids. I think we're all familiar with hearing aids, but if not, hearing aids are small electronic devices that are worn either worn in or behind the ear, but that typically refers to the processor. There are some molds that just fit in the ear itself, and then there's some that fit on the outside with the device in the ear. So the idea here with hearing aids is, as a basis of the feature, is that if there is hearing loss, that's part of the diagnosis, that you're bringing up background or environmental sounds that you may not be picking up. And what that can do is serve as a way to mask the sound that you're experiencing. As one thing there, we'll get into a little bit more on that as well, about other features. But as I alluded to be clear, hearing aids supplement the volume of outside noise and increase the amount of sound stimuli received and processed by the body's auditory system. So in a survey of hearing health professionals like audiologists, respondents self-reported that roughly 60% of their tinnitus patients experienced at least some relief when wearing hearing aids. It's about 2/3, and 22% found significant relief. So that's just something to keep in mind. And then we'll go to the next page. So this is an example of, hearing aids, as I talked about. It can boost the environmental noises, masking the tinnitus. As well, some hearing aids do have special features that include sound therapies. A specific example would be something called Zen technology. An audiologist can review this with you, but it's a way that sound therapies that I mentioned earlier, like the things on applications on your phone, can actually be implemented within the hearing aid itself to help in the process. So it not only provides masking while using it, but it also can contribute to habituation to tinnitus, which in turn is a positive feedback loop, can help with relaxation and reduce stress and anxiety that can trigger or make the tinnitus worse that somebody's experiencing. And we can go to the next slide. Common question we're asked to: medications and supplements. I will always tell people that currently there are no FDA-approved medications or supplements for the management of tinnitus. You may, again, kind of doing independent research and seeing what's out there, you may see like certain vitamins, supplements, combination of things. I would always ask, one of us, a provider or somebody, if it's safe to take. Most of them wouldn't cause any harm, but you want to make sure there's no interactions with things. But again, I don't, wouldn't endorse using it, from that standpoint. As we mentioned earlier, untreated or undertreated, suboptimally treated conditions, depression, anxiety, those sorts of things can also worsen tinnitus for an individual. So to be clear on that, the medication to optimize that sort of situation, if it's depression, would be, we want to make sure that that's well managed. And if that is, then the experience of tinnitus for that individual should be far less. Yes, so medication along with counseling and therapy may be helpful for individuals in reducing their tinnitus burden. That is the take-home message from that. Next slide. Discussing with one of our audiologists, I was actually not aware of this. This is something new that I learned. Melatonin. So there was a study that showed that melatonin is associated with a statistically significant decrease in tinnitus intensity and improved sleep quality in patients with chronic tinnitus. They found that, interestingly, conclusions here, it's most effective in men, those without history of depression, those who have not undergone prior tinnitus treatments, those with more severe full-sided tinnitus, both ears, and those with a history of noise exposure. So it's very, very specific population of people that they found effectiveness in, but interesting nonetheless. But as you could see in there, improved sleep quality, mentioned before insomnia, so that may have something to do with it as well. Regardless, as I had just mentioned, we always recommend you discuss the safety of taking any supplement like melatonin with your primary care provider first, because we would always have concern about, number one, the appropriateness of that, and then number two, any concern about drug supplementation interactions. So always discuss that first before implementing something along those lines. And we'll go to the next slide. So experimental therapies, this is from uptodate.com. This has basically what is kind of the latest and greatest research. They go through like meta-analyses, basically statistical parsing to find what is, what's the latest and greatest with certain things. There's repetitive transcranial magnetic stimulation. So I had to look up some of these things too, because there were a few things I was privy to, but not a lot of them. So I'm like, okay, what's this all about? So it's basically repeated electromagnetic pulses to underlying brain tissue. It's non-invasive, meaning that's a non-surgical option. Next thing is transcranial direct current stimulation. So you can think of it's the same as above, but you have multiple electrodes around your head. Interestingly, they did find that the early studies were promising. They were finding that people were self-reporting reduced or even relief from tinnitus. But there isn't any randomized controlled trials, which is kind of the gold standard, testing it against, placebo. And you also have to look at safety and efficacy too over long term before you can make a recommendation like that. Deep brain stimulation. People may be familiar with this, including myself. Parkinson's disease, movement disorders. Interestingly, they wondered if there could be a role for that, and that people that have tinnitus and Parkinson's diagnoses together, they noticed that when they were being treated, they noticed a reduction in tinnitus. So that was pretty interesting. And then the last two things are a little bit, those are also in, I should also mention too, deep brain stimulation, as you can see on there, is invasive. That's surgery. And then same with brain surface implants and vagus nerve stimulation. Those would also be invasive. Vagus nerve stimulation, interesting. You have 12 cranial nerves. That's one of them. They found that they can use that for treatment for depression, something new I learned as well. Then they posited that, could this also help with tinnitus? But obviously there definitely needs to be more research done in that area as well. That just covers some of them. There's a lot more. There's a lot of other things that people are doing raw research on. I won't get into those too much in detail, but this just kind of gives you an overview of what's being looked at. Next slide. Tinnitus support groups, a good starting point. least from doing, research on my end over a number of years to see, okay, what places provide the best, best places to start for somebody. The American Tinnitus Association, they have support group listings and meetings via their website. Then you have to look specifically. It's like state by state. Not every state's listed. When I was just there recently, I didn't see any blurb about Michigan per se, but if an organization puts on some sort of support group or forum, and then they're associated with the ATA, they will usually post, meeting time. Obviously, that's changed with the pandemic, with online versus in-person support groups. Another avenue of consideration is tinnitustalk.com. It's an online support forum. Usually has like latest news, treatments, research, and just general individual support for people, suffering from tinnitus. I'm a registered member user of there, so I do go there, fairly frequently to see what's being discussed. I will always admit I don't know everything. I try to know as much as I can, and sometimes you'll find things there that you weren't privy to on there. But I always say for any of these online forums, you always want to ask somebody professional to look at it alongside you or help you interpret what's being said if you don't have a complete understanding. And maybe implement some things that seem questionable. If something like that happened to pop up there, definitely always ask healthcare provider for some input on that. Next page. So Miss Rossetto was kind enough to share her experience of tinnitus, and you can see these quotes here that, it sounded like a loud, annoying cricket in my ears. It was constant. I could never have a moment of peace and quiet. And after habituation, which Ms. Rossetto used sound therapy techniques, which we covered, use audio tones to train the brain to ignore the ringing sounds over time. She was also a good candidate for those, tonal adjustments that allowed herself to manually change the settings based on what she needed. So during this whole process, which can take, X amount of time, the ringing sound went from absolutely unbearable to something I don't really think about anymore. It's a world of difference. And that's really, and that speaks volumes, is that's where we want people to get to that point that do have tinnitus. So it can take, again, not a one-size-fits-all approach, but if this helps provide, some hope, I hope that it does. We can go to the next slide. So COVID-19 and tinnitus, I'm sure this could be a separate conversation in and of itself for a long period of time, because I'm learning new things too alongside everybody else that's out there. This was within the last month. Recent news reports have brought up questions regarding new onset tinnitus and COVID-19 vaccinations. I believe, just going off memory from this article, is a vaccine, either researcher, physician in Minnesota that had in the series of vaccines, noticed shortly thereafter he had tinnitus in both ears. So he began to think, is there something to this? And being a scientist, you always, there are questions that if you have a hypothesis, you track it down and see, does the evidence support it? So at this time, there's no causal link verified without more research. So to be clear, there's not saying that there isn't an association, or there is. What we need, you need more data collected, more reports, and then you look at, are new onset tinnitus diagnoses happening more so than what you find in the average population is what you're looking for. But it's a very good question. And it's something that we do need to definitely keep an eye on, because you don't want to slam the door and say, no, that can never happen. You don't want to think in absolutes like that. So it's just an area of evolution, an area that we need to keep track of. And when it comes to COVID-19 vaccinations, I will always, defer to your primary care providers, or even if you ask me personally, to gather their advice on the safety and efficacy of the vaccines as well. It's always worth a discussion to have. And then the next slide. Also to COVID-19 and tinnitus, this is out of Great Britain. From the University of Manchester, they found a significant number of patients that were hospitalized with COVID-19 reported deterioration in their hearing, and 6.6% of those people actually developed tinnitus. So, COVID-19 is a virus. Viruses can attack nerves in the inner ear, can attack any of the cranial nerves that you have, again, which you have 12 of, and the ears are no exception. So there's, could be an increased risk from that standpoint. And also a global study of people that they found 40% who had COVID-19 symptoms reported that their tinnitus was more bothersome. So that could be for a myriad of reasons too, whether it's the inflammatory infectious process itself, any upper respiratory infection, if there's swelling in the nasal tissues and things of that nature, that can also amplify things as far as tinnitus is concerned. So things to keep in mind. And the next slide. So with all that being said, how would we approach starting our journey of hopefully providing relief? You would obtain a referral from your primary care provider, or you could call us call our office directly for further assistance. But that's usually the place to start, is you want to talk with your primary care provider first to refer you over to us for both hearing test and examination. An audiologist, as we mentioned earlier, will perform audiometry and tympanometry and a overall diagnostic workup of your ears. And then you'll discuss the findings with one of the medical providers and to see if any further evaluation is needed from some of those worrisome things that we discussed earlier. And then from there, we'll determine what kind of treatment options for managing your tinnitus would be appropriate. And then the next slide. Take-home message is that although right now a cure doesn't currently exist, we have to take a global approach, a combination of sound therapies, regular physical activity, perhaps hearing aids, and or counseling as appropriate can help alleviate the suffering and improve your quality of life. And we look forward to helping you find relief. As well, hopefully this also helps you understand the process of the pathological process of why tinnitus occurs better, so you have a more complete understanding of what's actually occurring to the best of our knowledge. And the next slide. This here is where our practice locations are. There's 2 convenient locations. On Cleveland Avenue in St. Joseph, phone number is there. And then we also have a location in Niles, Michigan. And then our website can be accessed as well for more information too. And then the next slide. And these are some of the resources and references I used here. Some of these may be available to you, like Google, if you use like Google Scholar, or even just what I specifically mentioned earlier, American Tinnitus Association or the British Tinnitus Association. Those are great sites to start with. Yeah, and hopefully that provides a more comprehensive picture for you regarding tinnitus. And then the next slide. And yes, thank you very much for your time. It's ended up being a lovely day today. There's nice weather, so thanks for spending. If you happen to be indoors, thanks for spending it indoors, and hopefully you can catch a little bit of the nice things we have as spring keeps progressing here. And I think we do have time for specific questions that people have, and like I said, I'll answer them to the best of my ability, as far as that is concerned. And still figuring out Zoom here, so we'll kind of look at like Q&A. There is a question here about, this is actually a very good question. A very good question. Why does my ringing seem to be louder when I change the position of my head? Yeah, it's a very good question. So I mentioned cranial nerves. With our the hearing nerve, I won't get into like the number of them. There's 12, but they're actually numbered. There is actually research that was done that looked at people closing their eyes or clenching their jaw or moving their neck a certain way. And from your spine, there's from your cervical spine, there's nerve inputs to the outer part of the ear. And then nerves that provide facial sensation, movement, function are also nerves that, if they found in a study that when they had people activate these nerves, they could actually track it with a MRI, functional MRI, and see that people that were putting these inputs in were actually having more activity of tinnitus. So it was actually activating parts of the brain and making tinnitus more apparent through either head movements, jaw clenching, and shoulder movements that they saw. So it's actually pretty interesting, but that's to the best of our knowledge of why that might happen. Another great question. I would like to know if tinnitus gets worse during the wintertime when the humidity is lower. Also, is there any relation to snoring, sinus infections, or high blood pressure? Oh, very good question. Wintertime when the humidity is lower, sure. There could be any number of reasons for that. Whether, dry air, dry nasal passages, sinuses, that could have something to do with it. It could be a myriad of other things too. Is there any relation to snoring, sinus infections, or high blood pressure? High blood pressure, very suboptimally treated, chronically high blood pressure, hypertensive emergencies, people can get louder tinnitus in their ears. Sinus infections, yes, if the sinuses and the nasal passages, are plugged up, by extension, maybe the eustachian tube that goes to the ears, that can amplify things or make it worse. Plus, if you don't feel good, there's a virus, something, or a bacteria that infected that area, that can amplify things too. Snoring, that's a very good question. It's possible. It's very possible. And I think, yes, is it typical for ringing to get worse when sinuses are full? And I'm going to assume, making an assumption here that, if there's facial pressure or pain, can be sinus, it could be other things, it is possible. There's also another question, does tinnitus tend to progressively get worse over time? Generally speaking, for most people, it does not. There are exceptions to that. Obviously, that can sometimes even indicate maybe a more serious medical problem going on. So from that standpoint, I always tell patients, the people that I see, that yes, if you're noticing it getting worse, we should reevaluate it with a new hearing test. Sometimes we'll even think about imaging the internal auditory canals, brain, and those areas too, if it tends to get worse or more apparent. That's a very good question, though. Can you share information on pulsable tinnitus? Yes, that can come from a variety of sources. I usually say if that's something you're experiencing either in one or both ears, that definitely warrants a medical evaluation. There are some serious considerations. Although rare, we would want to have that looked at. There's a spectrum of diagnoses that you would be concerned about. Pulsable means like you're hearing a pulsing sound, which it would imply, arterial type of blood flow. So that's a very good question. People can also have that sound too. If there's fluid in their ear, they might notice behind their eardrum there might be a pulsing sound. So regardless, I always recommend some sort of medical evaluation for that. Asking this very good question about aspirin. Yes. Aspirin, if any research that you read on aspirin, salicylates, those sorts of things, in really high doses, it can be what we call ototoxic, meaning that it can cause damage to the ear. So hearing loss, as we talked about, if that happens with taking the medication, that can also lead to tinnitus, which also means that, that could be a cause of worsening tinnitus from that standpoint. And how did you find specific medications that cause tinnitus? Of course, I could say Google. That could probably be an entryway. What you'll find is probably a small subset of things like certain antibiotics, mentioned aspirin, certain treatments, that are therapeutic treatments that are given for treatments for cancer. Sometimes we'll have people evaluated prior to treatment to get a baseline of their hearing, because some of those things can also be potentially affect the hearing as well. And the people who administer these things are privy to them, or we always say, hey, yeah, that should be evaluated if they're on there. But yeah, it's a very small list of things. There's larger lists too of some things that have been implicated in it. But hopefully that, I don't want to get into too specific, but that would help at least, hopefully helps at least answer this, provides an answer to at least some of that as far as medications are concerned. But very good, those are all very good questions. And I think I don't see any other questions pouring in, but hopefully that helps answer some of those questions. Always, if they're wanted, if you have tinnitus, it hasn't been officially diagnosed, by all means, we're happy to evaluate and go through all the things that we talked about to hopefully provide you relief for it, and hopefully answering some of the other questions to some of the mysterious things surrounding tinnitus as well. And I'll check here if we have any. And I think, yeah, any other questions out there? Or I think we probably are wrapping things up at this point. But again, I'd like to thank everybody for their time and input. But I'll hang around for a few minutes in case, if anything else pops up. All right. Thank you.